Welcome to another edition of Coffee and Tea with AARP Connecticut. This is a conversation with AARP staff, volunteers, and decision makers and influencers where we talk about the things that affect older Connecticut residents. At AARP, we represent age 50 plus Connecticut residents, about 600,000 of them who are members. And today I'm Nora, Duncan. I'm the state director of AARP, and we're doing things a little differently. I am going to have a coffee and tea chat with John Erlingheuser and Anna Doroghazi, who are on staff with AARP, and they are both advocacy and outreach directors for us. And we just finished our legislative session for 2021, as well as some brief special sessions, and there's actually, I think, another one to come. So we wanted to go over what happened, the good things, the accomplishments of the 2021 legislative session, and how that impacts the age 50 plus and everyone in Connecticut. So welcome. Thanks for joining us. John, Anna, congratulations on a very successful 2021 legislative session.
Great year and a great teamwork.
And we had many volunteers help us. We've had partners in advocacy and allies around the state help us on so many important topics. I think I am going to start off with asking Anna about the nursing home situation in Connecticut. We started out COVID-19 in March of 2020 in an immediate crisis mode in nursing homes. And in June of 2021, I'm happy to say that many of the things we were working on or finally have come to fruition. So Anna, do you want to highlight a few of the big issues for us?
Sure. So you mentioned just the huge impact that COVID-19 had on nursing home residents, both in Connecticut and nationwide. So in Connecticut, as of June 2021, we had more than 14,000 nursing home residents infected with COVID-19, and nearly 4,000 died. A lot of that was early on in the pandemic, certainly since we've seen widespread vaccination beginning in December of 2020, those numbers have thankfully finally decreased. But the pandemic really gave us an opportunity to take a look at long-term care facilities and think about what can we do better. COVID-19 was really unique in a lot of ways. Nursing homes were hard hit in part just because of the fundamentals of the virus. The people who tended to be most impacted were older adults and people with disabilities, and that is who lives in nursing homes. So those were issues and factors that were kind of outside of our control generally, but there were factors inside of our control that we saw as issues that emerged in nursing homes. Back in September, Governor Lamont commissioned a report from a group called Mathematica that took a look at some of the underlying issues that led to the tragedy that we saw in nursing homes. And there were a lot of issues like infection control protocols, staffing levels, lack of access to PPE that contributed to an already bad situation with the virus. So we saw legislation and we advocated very strongly in support of legislation that addressed some of these issues that we could control, that we think not only are an effective response to COVID-19, but looking forward are going to improve the overall care of nursing home residents. Two big bills that I'll just mention really briefly. Senate Bill 1030 was an act concerning long-term care facilities. This legislation came out of the work of the legislature's nursing home and assisted living oversight working group, the NAWLOG, and proposed a series of reforms that ultimately passed and were signed by the governor, including long-term care facilities need to have a 2-month stockpile of PPE. They need to improve staffing levels in facilities. They need to do some certain things to address infection control in their facilities. So some really good, very tangible steps taken there. Another bill that we were very proud to work on was Senate Bill 975, which was an act concerning the Bill of Rights for long-term care facility residents. So this bill, the overall framing was to give nursing home residents the right to treat their living quarters as their own home. And as part of that, nursing home residents moving forward are going to have the right to use the technology of their choosing in their rooms. This is something that AARP has been working on for a number of years. At this point, nursing home residents have not been allowed to install cameras, to use Alexa, to use Echo Dot, to use a lot of the technology that a lot of us rely on in our homes out in the community. And we're really pleased that legislation to make this technology now available to nursing home residents finally crossed the finish line.
Yeah.
So that was a lot, but we worked hard on a lot of issues there and have some great partners.
Yeah, and I'll give a special shout out to the state long-term care ombudsman, Mairead Painter and her team, who just really fought hard for these changes and have been great allies with us. So kudos to them and to the legislators who put in a lot of work on this. You know, we did a lot of nagging over the last 18 months, and it's finally paid off. So I'm glad to see this. So while we're on sort of the COVID-19 thing, I think, John, I want to go to you about changes to the way we are going to be voting in Connecticut, and what voters are going to see on the ballots coming up as a result of changes this session.
Yeah, great question, Nora. A lot of changes. Connecticut is one of the states that actually has some of the most restrictive voting procedures in the country, and that's really due to our state constitution. And there are a lot of restrictions that are built in there. And two of the biggest restrictions that are built into our constitution are those that say voting can only be on election day. So in-person voting can only be on election day, which in Connecticut is designated, like in our national constitution, the first Tuesday after the first Monday in November. And so that prevents a state like Connecticut from having in-person early voting, like most other states in the country, where they can actually go in any day of the week and vote for a designated period of time, usually 2-3 weeks prior. Another constitutional prohibition we have in the state of Connecticut restricts what people can use an absentee ballot and for what reason. Very, very limited number of people can use an absentee ballot. For example, you have to be ill personally, incapacitated, in the military, working at the polls in a precinct other than the one you vote in, things like that. Very, very limited amount of restrictions. So what Connecticut needed to do and is in the process of doing is putting changes to the Constitution out to the voters of the state of Connecticut. And there were two resolutions, House Joint Resolution 58 and 59, that would begin the process of making those changes. The voters will get the opportunity to vote on House Joint Resolution 59, which will remove the prohibition for in-person early voting. This is the second time the legislature passed that resolution by a simple majority. You have to, if you don't get a supermajority of 75%, it has to pass twice in 2 consecutive legislative terms, not sessions. So passed it in 2019, we passed it again in 2021, which means in 2022 that will go out to the voters on the statewide ballot. They can vote to remove those restrictions, and then the legislature will set up a process and designate the number of days and number of hours and number of locations that we could have in-person early voting. The other resolution, House Joint Resolution 58, only passed with a simple majority to remove the restrictions that exist on absentee balloting. So now we have to come back to the legislature again in its next term. So the earliest we can do that is in 2023, pass that again by a simple majority. And then in 2024, the voters will get a chance to vote on removing those restrictions. But there were also a lot of great other things that were put into the budget bill that recently passed. So for example, many people were able to vote absentee ballot because of temporary extensions that were granted because of COVID-19, so that anybody who would say the COVID-19 pandemic is a reason they didn't want to vote in person could vote absentee ballot. For example, I did. First time in my life I ever voted absentee ballot, but I chose to do it this year. Those temporary provisions, like being able to vote using an absentee ballot because of the pandemic, have been extended in the budget through this November's election. So the November municipal elections of 2021, anything that was in place for the presidential elections in 2020 are going to apply for 2021. In addition to that, we had Senate Bill 5 that AARP supported that didn't pass both chambers, but was included in the budget implementation bill as well. And that will extend a lot of the things that we had been hoping for, like those absentee ballot drop boxes that everybody really was fond of in the presidential elections are going to be able to be permanent now. So moving forward, we're going to be able to drop off election-related materials, ballots, applications, and the like into those secure drop boxes. We are going to expand voter registration, automatic voter registration beyond just motor vehicles to other state agencies like social services and other places. They're going to set up a process that the Secretary of State will have to approve of that will allow for electronic signature on most elections documents. And so there are so many great provisions in the budget and in the constitutional changes that we're proposing that we're going to go from one of the most restrictive states to right up there in the kind of top tier of states that are going to allow people to maximize their fundamental right, the most important right in the Constitution, and that's their franchise, their ability to vote. So, that's what AARP stands for, extending the franchise to as many people who are eligible as possible and making it easy for them to exercise that franchise. So a lot of good news for voters in the budget and in the that came out of the last session.
Great. Some of that's pretty complicated and some of it's pretty simple. And I'll give a shout out on this one too. Working with the League of Women Voters, working with the Secretary of State's office and with allies to get this done was really helpful and pushed things over the finish line.
Great partners.
Yeah. John, because you mentioned budget, I'm going to go to Anna and ask her some questions about the budget. I think it's a good segue. So the state has passed a $46.4 billion bipartisan budget, and we went into special session for implementation language, which always confuses everybody. So Anna, what was the good, the bad of the budget? What did we want to see and what did we want to not see, and how'd that all go?
Sure. So the budget was actually good in a lot of ways for older Connecticut residents. I think there are a couple budget pieces that I'll kick it over to John to talk about in a minute. But, right out of the gate, when we saw the governor's proposed budget, back toward the beginning of the legislative session, one of the issues that AARP always looks for and that we were very disappointed to see in the governor's introduced budget was an asset test for the Medicare Savings Program. So the Medicare Savings Program is an incredibly popular program used by tens of thousands of Connecticut residents. That helps pay for certain Medicare premiums, but also helps people pay for prescription drugs. When you're enrolled in the Medicare Savings Program, you're automatically enrolled in a federal program called the Low Income Subsidy, which makes it easier to pay for prescription medication. The original budget that we saw this year included something called an asset test for that program, which the very simple version of this is if you possessed assets over a certain level, you would no longer be eligible for this program. We always hear from members about this issue. I get a lot of phone calls, a lot of emails from folks who say, this is an incredibly important program for me. Without being enrolled in the Medicare Savings Program, I can't afford my prescription drugs. So we came out of the gate really, really hard and really fast and let legislators know that it was not acceptable to include an asset test for the Medicare Savings Program. And legislators are very familiar with this issue. I know they get a lot of calls about it, just like we do at AARP Connecticut. So during the committee process, we were able to have that asset test removed from the budget. And the final version of the budget that passed did not include the asset test. So that was, a big win on the, getting something out of the budget end. In terms of proactive things that we were excited to see in the budget, there is a really terrific program called the Connecticut Home Care Program for Elders that provides home and community-based services to folks who are both Medicaid eligible, and there's a state-funded portion for folks who who are not Medicaid eligible. It does a great job of providing some of the supports that folks need to stay in the community as they age. For the non-Medicaid portion of that program, there traditionally has been a 9% copay for services through that program. This budget reduces that copay to 4.5%, which is great for folks. That's going to be a big savings for a lot of people for a really meaningful program. Another piece that we were really excited to see that ties into nursing homes. For years, AARP Connecticut, the Long-Term Care Ombudsman Program, and nursing home residents have advocated for an increase to something called the personal needs allowance. For the past, several years, nursing home residents have been given $60 a month. And that $60 a month is really any personal expense. If they want a haircut, if they want to buy a birthday present for their grandkids, if they want to, buy a cup of coffee, so about $2 a day. And we were successful along with our partners in advocating for that personal needs allowance to go from $60 a month to $75 a month. So those were just a couple pieces in the budget that we felt really good about. And John, if I can kick it over to you on some of the tax pieces.
Well, those were great, important things. And, having somebody, my mother was on the home care program and she was at maximum care plan, which meant she got the most amount of money that you could get and paid the full 9% copay. And, that really drains down the limited amount of money they allow you to keep. So this is actually going to like double the amount of time people are going to be able to stay out of a nursing home and in their home. So I think that those are great achievements. On the taxing side, the governor proposed delaying by 2 years the phase out on the taxation of retirement income. AARP worked very hard to get the legislature to keep its commitment over the years to stop taxing retirement income in the state of Connecticut. We are one of the few states in the country with a state income tax that actually taxes retirement income, Social Security, pensions, annuities. So we were very pleased. We reached out to the Appropriations Committee. Our volunteers and our members testified in opposition to the governor's proposal, and the Appropriations Committee withdrew that, and we were successful in maintaining that throughout the budget process. So as the budget went along and was finally adopted, it did not include that, but it also did include an expansion into traditional IRA income. So, when you start to have to draw down that IRA income that you had, now that's going to be into the phase out as well, I believe, beginning in 2 years. In 2023, I think, is when that phase out will be put into the mix, because it expands gradually all the different kinds of incomes and the timeline for that expansion. So, not only are we doing great on the expenditure side, but we've gotten more progressive and more supportive of older Americans in Connecticut on the taxation side, which, as interesting as it may seem, and counterintuitive as it may seem, but, older Americans contribute more to the growth of the state of Connecticut than they actually take out from it. So it's something we always get a bad rap on, but if you actually look at the numbers, they're quite the opposite of what people may think. And I think finally the legislators are paying attention and seeing how important it is to maintain a tax policy that would encourage older Americans to stay in the state of Connecticut as opposed to fleeing. And I think we're really finally getting to that place, and the policymakers are following along with us. So we appreciate the work that was done on that as well.
John, you've led me to feel like I should take a point of personal privilege on my little pet project legislation. We talk about the longevity economy, which is what you're referencing, and having people stay in Connecticut, a piece of legislation that we've worked on for way longer than we should have had to, finally passed with only 2 no votes this year, and that was Senate Bill 56, which is an act deterring age discrimination. And that bill does something really simple, and it's effective October 1. No longer in initial employment applications will people be asked any age-related questions, date of birth, age, specifics like that, which seem really like they shouldn't be asked anyway, but they are. And Also prohibited will be asking about any school attendance or graduation dates. So you can't by default figure out how old someone is by asking what year they graduated from high school or by looking at their college attendance dates. So that will just give people a shot at getting through an interview process if there is discrimination in there. So we can start looking at people's experience and what they bring to the table rather than making assumptions based on age, assumptions which are most often false. And so we know a workforce that is diverse in all things, inclusive of age, is a much more productive and innovative workforce. So I'll give my shout out of this one to Senator Derek Slapp, who has been our champion on this bill. And I look forward to seeing that signed into law, probably as we speak, and going into effect on October 1st. And so I think with that, I'm going to ask each of you one more question so that we wrap in a timely fashion today. And I think what we just talked about really all are about how we make Connecticut a more livable and friendly state. And so Anna, I know there were some pieces of legislation that passed around livable communities. Do you want to share that with us?
Sure. So AARP in Connecticut and then nationally has a great initiative that we call AARP Livable Communities. And the idea, the underlying idea behind livable communities is how do we create great places to live for people of all ages. There's so many policies that benefit both 80-year-olds and 8-year-olds and people over 80 and under 8. So when you have good accessible parks and public spaces, when you have good access to transportation, this really benefits everyone. So one piece of legislation that we supported this year that falls into this livable communities idea was House Bill 5429, Enact Concerning Pedestrian Safety, the Vision Zero Council, speed limits in municipalities, fines and charges for certain violations, and the Greenways commemorative account. So long bill title. But there were some great provisions in that bill related to pedestrian safety. So there was a lot going on in that bill, as you might be able to guess from the lengthy bill title, but it improves safety in crosswalks. So for example, you no longer have to be standing in a crosswalk to be given right of way. You can gesture your intent to cross in a crosswalk. There are some parking restrictions within a certain distance on either side of crosswalks to improve visibility. This is terrific, again, for people of all ages, but the reason that AARP was especially enthusiastic about supporting this is that older adults are disproportionately represented when it comes to pedestrian injuries and fatalities. Some of that is just that our bodies are a bit more susceptible to that sort of injury and death when we're in collisions as we age. Some of it is reduced response time when the car's coming at you. It's a little harder to get out of the way. But again, this is a policy that benefits everyone. And we were really happy that we were able to bring a bit of a different perspective to the table and speak specifically about how this is going to benefit older adults. We've had some volunteers who've been really involved in this area, and quick point of personal privilege on my behalf as well. I think we'd be remiss to not mention how great it is to have our AARP volunteers come to the table during the legislative session, bring their personal experiences to the forefront, and be able to really speak from that perspective. John and I can kind of bring the facts, but it's great when we have folks who can speak to what legislation means for them personally. So thanks, volunteers.
I'll go a ditto on the thanks, volunteers. We are just 3 people who live in 3 towns, and our volunteers spread us out across the state so that they are the constituents of many, 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 many legislators, and they make sure their voice is heard on behalf of AARP. So we appreciate that. John, I'm going to have you take us home. And I'll say, take your 3 minutes here and tell me about what we've done in utilities, both broadband, high-speed internet, and in the third-party electric supply market.
Sure. Let me start with the third-party electric suppliers. And, it's an issue we've been working on for as long as the state of Connecticut has been deregulated on utilities. We've gotten a lot of consumer protections over the years, and I liken it to a game of whack-a-mole. For every kind of bad practice or misleading and deceptive practice that suppliers, the third-party electric suppliers who you can choose to get your supply from other than Eversource or United Illuminating, for every one of those bad practices, they get stomped down on, they pop up from another hole. So we felt it was necessary to once again go after these third-party electric suppliers. We worked very closely with the Public Utilities Regulatory Authority and Chairman David Arconti of the Energy and Technology Committee, as well as Senator Norm Needleman and Senator Paul Famica, the ranking member, and ranking member Charlie Ferraro. It was a good bipartisan bill that does several things. So first of all, one of the most important things that it does is we passed a ban on variable rate contracts back in 2015. Legacy contracts, the existing variable rate contracts were grandfathered in. It's almost undeniable that those are the folks paying more than the standard service rate. So as of July 1st of next year, those contracts will be null and void and will not be able to exist anymore. The next most important thing that it does is it eliminates all cancellation fees. There's currently a maximum of a $50 cancellation fee to get out of a bad contract. Those will be eliminated. And it'll also require suppliers to give an estimated monthly bill for a contract with their product, which is also important. And then, in addition to that, it gives Pura the ability to condition a supplier's license on the fact that they're offering a product that's of value to people. And value means, I'm not going to get mileage points on my credit card, but that you're actually going to save me money. And, so these are important things. We're really going to have the strongest set of consumer protections in the nation as a result of this bill. So thanks to our partners out there that worked on us with this. And then I will also say we did pass another bill that would deal with broadband, and we call it high-speed internet. It's very important. The pandemic, as we talked about with nursing homes, proved the need for high-speed internet for folks, for remote learning, being able to work from home, for telehealth, virtual visitation in nursing homes. People died in nursing homes without ever being able to see a loved one again because of lack of access to high-speed internet. So we worked very hard to get a bill. It's not the strong bill that we would have hoped, but at least it capitalizes on federal dollars and will begin to map out in Connecticut the places that we know there is a lack of access to high-speed internet. Providers will tell you it's only about 25,000 people in the state of Connecticut. We know that's not true. We believe there are about 300,000 to 400,000 homes who lack access to affordable high-speed internet. The state of Connecticut is going to have to map out where those homes are, and then there are going to be grants using federal dollars to allow the build out of high-speed internet in those areas. So either the community themselves can do it, or the providers can be incentivized to go to places they don't currently go to because it's not profitable to them. But it's a good start, and we're happy to have worked with the governor's office on this. And we're a little disappointed the regulation portions of it that we wanted are not in there, but there's always next year. But this is definitely a good start. So good year for us on the utilities front.
Awesome. Thank you. So what else we should thank is our e-advocates. There's a lot of people out there who take action on our issues and tell their legislators and the governor and also our federal delegation what they think they should be doing based on information that we're able to provide. So if any of our e-advocates are watching, thank you very much. Anybody who wants to touch base with us, wants to become an AARP volunteer, wants to learn how to become an e-advocate, can email us at ct@aarp.org. ct@aarp.org, pretty easy. And then you're going to find a nice write-up of a lot of the pieces of legislation we discussed here today on our website, as well as some more things that we didn't discuss that passed, just because we don't have enough time to celebrate all of our successes today. So we'll just hit the big ones. Again, thanks to everybody. You guys did great work this session, and we really do thank the General Assembly for some of the most bipartisan support on our issues I think we've ever seen. And, to quote our state president, volunteer Tia Murphy, there is a tarnished silver lining to some of this pandemic. And it's evident in the end of our legislative session, I believe. So we got another little special session coming up on our federal dollars, and people can keep an eye on our website for more information about that. It's aarp.org/CT. Thanks very much, everybody, and enjoy the next few weeks before we're back with another Coffee and Tea with AARP Connecticut.